Hey, everybody, it's Dr. Sean Tassone, America's Holistic Gynecologist, coming at you from Austin, Texas, where I have my private practice and can see patients in 27 states. I did a YouTube live yesterday on the states where I'm licensed in. So if you want to remember, go back and look at that. I'm also the author of the Hormone Balance Bible, which is a guide to giving you a more holistic approach to balancing your hormones. And the fact that it's called the Hormone Balance Bible brings me to today's discussion. Can you really balance your hormones? Now, there's doctors out there like Jen Gunter, Jen Lincoln, Mama Baby Jones, or Mama Dr. Jones, whatever the heck her screen name is. Maybe Mary Claire Haver and Kelly Casperson, who completely disagree with me on this concept. And they say that you can't balance your hormones. The reality is you can, because and I'm going to tell you why that they say you can't. They would say you can't because your hormones fluctuate throughout the cycle. And that's true. Estrogen peaks in the first half, progesterone peaks in the second half. Testosterone can peak at ovulation. So they're constantly up and down. So theoretically, there's not a balance in the sense that it's, a 1-to-1 ratio. But they get caught up in the semantics simply so that they can discredit anybody that thinks differently than they do. The reality is you can balance your hormones. And I say that because let's take, for instance, labs. Let's say you have low testosterone. Okay, it's low normal, 2 to 64 on a total testosterone, and you're at 2. You are as low as physically possible. Technically, it's normal, but it could feel horrible. You may not like it. Those other doctors would tell you you're fine, but you may not feel fine. I could multiply your testosterone 30-fold and it would still be normal. You may feel a hell of a lot better. So to say that that's not a balance, to say that the balance is not there, when you feel better, where you are in your life. And to say that you cannot balance hormones is wrong. It's completely wrong. If we didn't think that there was such a thing as hormone imbalance, then why do we treat a hormonal issue like polycystic ovarian syndrome with birth control pills that are hormones? If we're not trying to balance out the hormones, why are we using hormones to fix the problem? So there is something called a hormone imbalance. It may not be medically diagnosable, meaning you can't like put a ICD-10 code on it, but to say that it doesn't exist is just bullshit. I'm sorry, but it is. Let's just call a spade a spade. It is what it is. They're being obstinate because they don't like anybody that makes money except for them. So what happens is when you get these negative comments, when you get, especially from other doctors, oh, they're just trying to sell programs. And I say that sometimes too. I do think there is a little shred of jealousy there. What's funny about somebody like Mary Claire, run of the mill OBGYN, wrote a couple books, she's pretty tried, true, and, dyed in the wool, North American Menopause Society advocate. But I don't believe that she thinks testosterone needs to be replaced. I don't think that she talks about labs. And as I have talked about many times, the North American Menopause Society certificate doesn't mean anything. It's not worth the paper that it's printed on. And that's because they only teach what they think is the truth. One of the doctors on that list, Jen Gunter, actually says that she wields the golden lasso of truth. But it's her truth. It's not my truth. It may not be your truth. So there's different truths, and it sounds silly, but there are. So let's talk about hormone imbalance. Again, if it doesn't exist, then my 500-page book is total trash, and they would probably agree with that. But I don't believe it is. I think you can be off, or else we wouldn't have normal ranges. And when it comes to estrogen and progesterone, I also believe that women feel better when those ratios are around 10 or 20 to 1. When you start getting into ratios where the estrogen is, 30, 40, 100, 1,000 times higher than the progesterone, you start getting into that estrogen dominant phase. Now, they'll also say that estrogen dominance isn't a thing. And to their credit, It's true. It's not a medical diagnosis, but you can certainly have way too much estrogen or way too little progesterone. The problem with a lot of the doctors is that they are mirroring the opposite side. So you have all these coaches, um, you have people out there that have absolutely no medical training that went to a course at the Institute of Integrative Nutrition, which is another sham organization that makes up certificates. But the reality is they're not nutritionists, they're not registered dietitians, and they certainly aren't hormone experts, but they say they are. And so my colleagues are fighting that aspect. So they are becoming more and more big on the opposing side as these other people claim their expertise in a field that they really aren't experts in. And they're making $7,000, $8,000 on a program that's just a lot of supplements. And to each his own, to each her own. I mean, whatever floats your boat. I can see the arguments on both sides. But what happens is because my colleagues are trying to be so obstinate and so opposed to anything different, they shut down any possibility. And when they do that, they shut you down. So when they say to you, hormone imbalance doesn't exist, it doesn't do any good to draw your labs because they fluctuate all the time. I don't draw labs. Testosterone's never been shown to help women. There is no FDA approved testosterone. The FDA, the hormones they use in compounded hormones aren't FDA approved. All those are just basic lies. And they're doing that to basically dissuade you from going to see anybody outside the system. So please, please, please keep in mind that the best place for you to be is where you feel the most comfortable. Now you could spend $10,000 and get no help whatsoever. And if you feel listened to and cared for and happy, then that's really what ultimately should matter. We can post about scams and we can say our mind, but at that point, it's just our opinion. And so keep that in mind. My colleagues are struggling. They're trying to win back the population that they lost by being jerks in the first place, by not listening to patients. So it's a double-edged sword. We lose patients because we don't listen. They go outside the system and find something that makes them happy. And then we have to attack that which is making them happy so that we can get the patients back. The problem is it just makes us look like bigger jerks. And the reality is they go stay there with those folks anyways. So I'm going to answer some questions. Is it possible to get a ripped physique without exogenous anabolic steroids? Well, I don't answer questions on men's health, so you're going to have to go somewhere. Maybe go follow Greg Doucette. Totally agree with what you are saying. I mean, it's too bad that you have to come out and say stuff like this, but at the same time, my colleagues double down all the time. They will find somebody or something or some product they don't like, and it is like vultures on a dead corpse. They are picking and prodding and poking until you basically can't do anything else. And what they do on the back end of things is they kind of run the show. For a guy, I mean, I'm never going to get invited to any of that stuff because I'm a man, which is fine. Men have had their turn and women haven't. And so I get it. And women's health is super important. And if women providers get women to ask questions, then that's great. The problem is, I think 75% of the GYN providers right now are female, and they're the ones that are shutting women down. They're the ones that are gaslighting. So I think that goes both ways. Hey, doctor, I've been postmenopausal for 12 years, no HRT, not 55. I'm feeling it's too late. It's never too late. You can call somebody, they can check you, they can prescribe hormones. Got to talk to you about your history and everything, but it's not really ever too late. I had a hysteroscopy and nothing but pathology said there was a polyp, non-cancerous. That's good. Should they have done a DNC? If they got a polyp, then they did a DNC because that's the only way you can get a polyp out. My estradiol was 142 over a year and a half, but last month I went into menopause, so now I don't know what to do. They keep suggesting a hysterectomy. I can't really comment on your care because I don't know anything about you. So, and this is, you can't answer medical questions on social media. So Feel free to give my office a call if you want me to take a look at your records. I'm more than happy to give you a second opinion. Thanks for calling out NAMS. Many of these doctors are the contraindication or certification to make money. And let me tell you something about NAMS. NAMS is for two people. One of those people are the people that don't know shit about hormones. They know absolutely nothing, and they just got to take a class somewhere. The problem is NAMS teaches them big pharmacy. They don't teach them bioidentical. They don't teach them about testing, really. They don't teach about testosterone at all. And yeah, it's a very limited worldview, but it gives them some training. And the second person that goes through NAMS is somebody that's not in a hormone related field. Like, let's say you have a nurse practitioner or a doctor, like an orthopedic surgeon, and they go, I'm burned out. I don't want to do orthopedics anymore. I'm going to do women's health because there's a lot of money to be made. But I have to have certification to show that I'm an expert. So they go to NAMS and they do the training and take the stupid quiz. And then they promote that they're a NAMS practitioner. It's ridiculous. I've been doing this for 25 years. I don't need NAMS to tell me how to do things. So I don't get NAMS certified. It's not worth the paper that it's printed on. Sorry for those of you that are NAMS certified. I think it's ridiculous. Just like people that do these business classes at Harvard or something, and they'll say they went to Harvard. You went to a 6-week class at Harvard. You didn't go to Harvard. Okay. But that's what Harvard does to make money. They charge like $1,000 so these people can put Harvard on their application when the reality is they did a 6-week course. But it's the same thing. You don't know anything great about hormones when you leave NAMS, and they only teach you a very limited worldview. So when you're going through the NAMS list providers, don't think you're just going to find somebody that's amazing or outside the box when it comes to hormones, because they're trained by the system. I started estradiol cream about 2 months ago after watching your video. I'm concerned going off, called your office today, and I'll be getting my blood. It's a good idea for sure. Always a good place to start. Check levels. Yeah, yesterday I had the lady who was doing estradiol cream, obviously told, oh, it doesn't go systemic. And her estrogen was through the roof. It does go systemic. Has to. I mean, the blood vessels that are in the vagina are quite numerous. The vagina is very blood rich because of that area of your body and what it does for babies and whatnot. To think that the medications that are absorbed through your vagina don't go into the bloodstream is ridiculous. If during perimenopause your estradiol was 148, causing thick endometrium, the menopause kicks in and levels normalize. Well, they don't normalize in menopause, they go to zero. I can't answer a personal medical question for you. I'm not your doctor, and I can't give medical advice. If you want to call the office at 512-956-0296, I'm more than happy to give you some advice through that. I was taken off HRT 10 years ago because of DVTs. I have not been the same. The DVT risk is in oral estrogen. Topical estrogen has never been shown to increase the risks of DVT. So you have to look at the risks and the benefits, the rewards, and how you can live your life. And if you don't feel like you're living the life that you want, then I would say reach out and do what you need to do so you can get the help that you need. I'm going to shut it down for today. I hope everybody's doing okay. I just wanted to say that I appreciate all the feedback. I appreciate all of you that have made appointments. If you feel like you want an appointment, you can give me a call at 512-956-0296. I hope you're all having a great day.